It will give you such a great introduction, and I just wanted to maybe perhaps give some clarity, because I know sometimes it is tricky trying to, decide, well, where do I fit and how do I matter and how do I know what I'm talking about. So in the UK, I work for the equivalent of their Ministry of Health. My responsibilities in the UK are for the implementation of autism, learning disabilities, and special education needs care within one of our 7 regions in the UK. And alongside that, I have responsibility as a Deputy Director of Nursing for Professional and Systems Development. So, in essence, the crux of my role is to ensure that those vulnerable individuals, particularly those most vulnerable in our society, is getting the right care in the right place at the right time that is of a high quality and standard and representative of good outcomes. And why I'm here in Ghana, apart from the fact that I love Ghana so much, and many of my favorite people, including the amazing Roslyn and Ava and many others who are in the audience, live here. Because Ghana has embraced me so warmly and wonderfully since the first day I arrived. So I love Ghana, and it's because of my love for Ghana, I want to bring what we have learned in the UK, some of the good practice that we've got there, and share it with you to help to improve the experience of care for those vulnerable people in Ghana, and also to take information back, because I think it's really important for you to understand and acknowledge that there is excellent practice happening here in Ghana, great use of resources, extremely skilled, qualified, dedicated professionals and others that work in the system here that you really need to get to know. And the fact that you are here today is demonstrable of your commitment to do that. And also, there is so much more we can do as individuals to improve the care and support that we have here. So I will tell you a little bit about some of what we are doing in the UK that I believe is really relevant to how we can improve the experience of care here in Ghana. For a start, we are looking at collaboration. And as we know, if we want to go further, we want to have a sustained journey, we have to do that together. So we have brought together our systems in partnership. So we've got health, we've got education, we've got social care, all coming together with third sector and charity-based organizations to support and improve the experience of care for those vulnerable people. What we are doing is seeking to ensure that we pool very limited resources, because it's the same story for us over there. We need money to drive everything. And when I talk about resource, I'm not talking about it only in the context of financial resource. I'm talking about it in the context of people. So we are pooling everybody together to look at how we can improve those experiences. We are looking to improve access and care and support. So using areas that might be unconventional to make sure that we are capitalizing on every opportunity to identify those in need, do assessments to ensure that we understand the need as it presents, and also look for opportunities to provide intervention and support at sometimes areas that isn't the usual. And a lot of that is in recognition that not everybody comes forward for support, and I'm sure many of you would be familiar with that, because stigma isn't limited to certain communities. It actually extends broadly across the board. Many people fear what they don't understand, and as a result, don't often report early to get the support that they need to help improve their outcomes and improve their opportunities in life. So many times, because of that delay in coming forward, a person may find that they may have a reduced outcome, they may have issues in their education, which I'm sure all of these things we'll hear more about. But it's vitally important to make sure that we encourage those who need support to come forward to get it. We create areas for that to happen. We also create wider areas to give therapy and intervention. And even in the UK, we are still building on those. Another area that we are focused on is about physical health care, because we recognize that many of those who are vulnerable oftentimes die from illnesses that are preventable. So for example, something as simple as constipation, sometimes poor dental care, that doesn't necessarily cause death, but that creates a lot of issue along the way. Oftentimes we find respiratory issues, people don't respond to get treatment. Simple screening like breast cancer, cervical cancer, testicular cancer, these are things that our loved ones, our vulnerable people are dying from when they could have been treated or have longer lives and better outcomes. So we are seeking to ensure that we implement policy and practice that supports us identifying and treating those in those areas. And I'm hoping that we can influence and improve some of the policy making and policy implementation here in Ghana as well. And we recognize that to do that, we only do that with more voices. So one of the aims of the conference is to encourage support for change, see how we can share this information together as communities where we can start pilots, because as we know, people sometimes respond better when they can see evidence of what the outcomes can deliver. And we can do that in small pockets. That's how we do things in the UK too. So we have very small pilots, evaluate them, look at the outcomes, and then present them to those who have the funding and the resources to look at how we can scale and spread those to wider communities. And that's exactly what we can do here in Ghana. That's exactly what we are hoping to do at our newly opened therapy hub and center that we have in East Legon on Jungle Avenue. So it's one place that we are starting, and we know that we have many partners across Ghana, Accra, and wider who are doing this great work. Some of them you will hear speaking today, but we are hoping as we move together in unison, as a coalition, in collaboration, that we are going to be able to do a lot more. Now, I'm mindful of time, and I want to say to you, if you are interested to get involved, you can get in touch with us via our various media platforms. You can get in touch with me directly via my Instagram. If you Google me, you will see everything come up on the link tree. Please reach out. I know there's a lot of great work that's happening in Ghana, and I am mindful that because we don't often have platforms and opportunities to speak with each other, we're not able to share and grow together. So we are hoping to take this Pan-African. I can see some of my Nigerian sisters just come into the room, and I want to say as well, we are hoping to work in partnership with Nigeria, because we know, as I say, we are stronger together, we can go further together, and we can make sure that any change that we bring is a sustainable, long-lasting one in all of our communities. So, on behalf of the Reyo Foundation and our great colleagues that we have in the UK, I want to say thank you. Thank you for your time, thank you for your attention, thank you for your commitment by joining today, and I look forward to working in partnership with all of you. So, before you go, those of you who were here last year will remember my motto, and it still stands. Each one should teach one. So any information that you learn here today, any resources that you get here today, you take it back to your own place of work, your own place of rest, your own community, and you share that information, because often we don't recognize how a small conversation, a small bit of information shared can make the world of difference to someone. Okay, so thank you everybody. Have a wonderful and a fantastic day.